guys, welcome back to the Chronic Illness Diaries. So I noticed that I have a bunch of new subscribers and I kind of wanted to update them, just kind of, bring them into the know, I guess I would say, of my medical diagnoses, and just so that they kind of understand my content. And this may be good for people who've been subscribed for a while too. So back in around 2009, I was diagnosed with rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, and I was put on hydroxychloroquine. That medication did not work for me, so they put me on methotrexate and eventually on Humira. So fast forward to around 2012, I went to the doctor and they just randomly checked my blood sugar. It was very high, and they instantly said I had type 2 diabetes because I was an adult. However, about 6 months later, I would learn that they were very wrong. About 6 months later, I went into what's called DKA, diabetic ketoacidosis, and anyway, I was admitted to the hospital. The hospital did a bunch of blood tests, and they actually figured out that I had positive GAD antibodies, which made me a type 1. I was then diagnosed with latent autoimmune diabetes of adults, also called LADA, and that is type 1 diabetes. I was put on insulin immediately, and within a few months I was on an insulin pump and a continuous glucose monitor called a Dexcom. So in between that time, I was still working. I was doing okay. I don't know. I mean, yes, being diagnosed with type 1 diabetes was hard, but I don't know. It didn't really affect me all that much. I had the tools that I needed to deal with it, and life went on until June 27th, 2015. Up until that time, I went to my regular doctor's appointments, and they noticed that my heart rate sitting down was 150, and they didn't really understand why. I only found out about this later. They told me about it after the fact, a year after the fact. But anyway, that was probably our first clue that something was going on. But anyway, going back to around June 27th, 2015, I had went to the hospital because I was having severe kidney or flank pain in my back, and they ran a bunch of tests. I was severely dehydrated, so they gave me fluids. My heart rate was through the roof. It was 180 beats per minute when it should have been around 60 to 80 beats per minute. So anyway, they did the fluids, they did a CT scan of my kidneys, and basically, they sent me on my way, and then had given me a referral to a heart specialist, and that referral wouldn't happen for another 3 months. So back in June 27th, 2015, that's basically how all this craziness, or when all this craziness started. Like I said, I went to the ER, and they set me up with a cardiologist because my heart rate was insane, and then they set me up to see an endocrinologist for, of course, my diabetes, but I was drinking everything in sight and then just peeing everything out. I could not stay hydrated. So I'm going to fast forward a little bit to July 2015, and something prompted me to gather my medical records. And when I did, I read the ER report from back in June of my kidneys, and in the report it said that I had a 2.1 centimeter adrenal mass, and it said that it needed further workup. No one told me. How do you miss that? How do you not tell patients that they have a tumor on their kidney? I don't understand, but that's what happened. And So I really encourage you, read all of your medical records, everything. Read the notes, read your blood work, read the scans, everything. So anyway, I had that knowledge in the back of my mind, and I went ahead and made an appointment with endocrinology, and I believe that was around like August 6th, 2015. I went to see the endocrinologist, and he was like Googling right in front of me how to work up an adrenal tumor. He had no idea. So that wasn't very comforting at all. But anyway, he ran a ton of blood tests. They did another CT scan, and he was confident that it was benign, not cancer. So I'm like, cool, life goes on, and I went ahead and went to my cardiology appointment that had been scheduled, and found out that this was in end of August 2015. I found out that I had cardiomyopathy and possible acute heart failure. So I was kind of freaking out, like, what in the world? What causes this? How can you be a relatively healthy 30-something-year-old adult and suddenly have heart failure? So yeah, that was interesting. I had an echo done, an ultrasound of my heart. It was done on a Friday. My best friend went with me, and then we got a phone call around 6 p.m. that night, and it was the doctor telling me that I was in heart failure. So they set me up with all kinds of appointments. It was a crazy, really crazy time. And then around September of 2015, I went through a water deprivation test because I was drinking and peeing everything out. So my endocrinologist had scheduled a water deprivation test. I failed the test and was diagnosed with a pituitary disorder called diabetes insipidus. And basically your pituitary in your brain doesn't make enough of a hormone called vasopressin, and that causes you to drink and drink and drink, and you pee everything out. So when I think back of what I went through in those first 3 or 4 months, it was horrible. It was really, it was just one thing after another, and it was all these crazy things. So yeah, anyway, the first week of September 2015, I'm going to back up just a little bit. I had also had a port implanted. It was actually on this side. There's a scar right here. I had a port implanted because my veins are so terrible. They were sticking me like 15, 16 times for an IV or for a blood work, and they couldn't get anything. And I really needed to have access to blood work and IVs for what I was going through. So I had no idea when they put my port in how much, it's like somebody was looking out for me, because I had no idea at that time how much I would be using my port. So between September of 2015 to about June of 2016, they continued to monitor my heart. My heart function was declining, and no one knew why. My heart rates were still extremely high, and again, they had no idea why my heart was doing these things. So I'm trying to think. Oh, and then during that time also they found parotid tumors, like your parotid glands are right here and right here. They found parotid tumors in my parotid glands, and I have had so many biopsies done of those. They're not entirely sure what's going on with my parotid glands. They could possibly be benign tumors, like it's called Warthin's tumors, but I haven't gotten anything conclusive on what's going on with those. So I'm trying to think. So June 2016, during this time we had figured out that every time I would go to the ER and they would give me 2 or 3 liters of IV fluids, my blood pressure would come down like to a steady level, and my heart rate would come down to a normal level. So in June of 2016, I started on home care. They would come and access my port, and then I was on continuous IV fluids to help bring my heart rate down and my blood pressure down. But we didn't know exactly what my diagnosis was at that time. We just knew that those things worked, if that makes sense. So, let's see, in, trying to think, October of 2016, I saw a cardiologist who was, I don't know what the word is, like a specialist in autonomic disorders, and after some testing they concluded that I had something called dysautonomia, which I've talked about in my previous vlogs. Dysautonomia is a failure of the autonomic nervous system, so everything that your body does without you thinking about it, my body is failing to do those things. Things like pupil dilation, respiration, your heart rate, blood pressure, digestion, the way, like going to the bathroom, all these different things that you just don't think about. So anyway, I was diagnosed with dysautonomia, and it was dysautonomia that was causing my crazy high heart rates, and that was causing my heart to fail. So when we slowly started getting hold of the crazy heart rates from the dysautonomia, my cardiomyopathy, the heart failure, it stabilized, and my ejection fraction for my heart rate, or from my heart, goes up and down, and it just kind of depends upon how well I'm doing at controlling my heart rate with the IV fluids and the medications. So praise God. You know, they really thought that I was going into acute heart failure, and that it was very possible I was going to need a heart transplant because of how fast I was declining. So anyway, we finally figured that out. That has helped. So from 2016, I decided to investigate the tumor on my adrenal gland a little bit more. I noticed that the doctors around here, they're clueless. They don't know what tests to run. So I took my case to the University of Michigan, Ann Arbor, and they have one of the only adrenal cancer programs in the entire U.S. So they looked over my records, and they concluded that my tumor, they were 99.9% sure that it was benign. And they were wrong, and I'll get to that in a minute. So anyway, I went up there, they looked over all my blood work, they looked over my scans, they said, you're good. Sorry about that. They said, you're good, life goes on, you know. So that was 2016. From 2016 till June of 2017, I continued to just deal with all these medical issues. Again, I was still on home care, having a nurse come out and help me with accessing my port. During that time, I had been diagnosed with gastroparesis and put on an NG tube, which I talk about in some of my other videos. And back in, okay, so sorry, this is a lot, and I know it's a lot for you to take in, but it's, you know, over 5 years, a lot happened. In June of 2017, I had another CT scan done of my adrenal glands, and the tumor on my adrenal gland had grown. And all along, my primary doctor had been very suspicious of the tumor. She and I both had a very bad feeling about it, that something was wrong, something was amiss. But everyone around us was telling us, oh, adrenal cancer, it's so rare. You know, your tumor's too small. It's too rare. You don't have that. Well, So in June 2017, we decided to wait 6 months and then do another scan, about 6 months. In November of 2017, I think I got these dates right, 16, June, November of 2017, we did an additional scan and the adrenal tumor had grown. So that prompted my primary care doctor to push for a PET scan. And there isn't a lot of research out there that supports the use of PET scans in adrenal cancer. But that PET scan, I think, has at least prolonged my life, if not saved it. So in December 2017, I had a PET scan done, and the PET scan showed that the tumor on my adrenal gland was lighting up, so it was likely cancer. But again, like, there wasn't enough research out there for doctors to say that, yeah, PET scans work or for identifying adrenal cancer. So I was up against a wall and a hard place. If it had not been for my primary doctor at the time pushing for somebody to take this tumor out, I have no doubt that I would have been stage 4 within 6 months or so. I'm going to try not to cry. It's been a really hard and long battle, and if it hadn't been for her, no one else was listening. I really feel like God gave her a prompting in her heart to fight for me. And I'm so, so thankful. So, in January of 2018, I met with a local endocrine surgeon, and after a lot of convincing from my primary doctor, this surgeon was convinced that I did not have adrenal cancer. She was convinced, like everyone else, that it was benign. For 3 years they told me it was benign. And it sucks, because if they had taken it out in the beginning, I would not be going through the crap that I'm going through right now. Anyway, the surgeon finally agreed to take my adrenal tumor out. I asked her to take it out via open surgery, like not laparoscopically, not keyhole, like open surgery. The University of Michigan recommends that patients have adrenal tumors taken out via open surgery. That seems to give patients the best outcome. Anyway, it's ironic, this surgeon, she did her residency at the University of Michigan, and she didn't think it was cancer, so she took it out laparoscopically, which is not the best practice. But at least she took it out, because no one else was willing to, and she wanted to wait another 6 months. If I had waited another 6 months, there's no doubt that it would have been stage 4. So anyway, February 6th, 2018, I had my adrenal gland removed and the tumor with it. And then for 3 weeks, they bounced my adrenal tumor all around my state, like to all the best institutions in my state. And I had begged them in the beginning, please send it to the University of Michigan. Again, they would not listen to me. They sent it everywhere around my state. No one knew what it was. And then finally, they listened to what I asked them to do. So for 3 weeks, it got bounced around. And then on February 27th, 2018, I was diagnosed with stage 3, high grade, which is aggressive, adrenal cortical carcinoma. It's a rare cancer. It only happens to 1 in a million people, and it does not have a good outcome in most cases. So again, I was headed back to the University of Michigan because they're the experts for adrenal cancer. I believe I saw them in April 2018, and they set up a treatment plan for me, which included the use of a chemo drug called mitotane, and I think it was 30 rounds of radiation. So anyway, I went to Michigan, I got my treatment plan all set up, and then I came back to my home state for the doctors here to begin my treatment. So I began my radiation treatments and the chemo drug mitotane, and about 2 weeks into, I think it was about 2 weeks, 5, 10, it was about, 2 weeks into radiation and the chemo drug, I started getting fevers all the time, and I was so weak, so tired, and I kept having like the shakes. I remember it was a Monday. I had went to get my hair trimmed. I came back home and I was just freezing cold, which I'm never cold. I was freezing and I was shaking so bad I couldn't even like text anyone for help or dial the phone to get any help. It was terrible. And then like it would go away for a day, and then it would come back for a day, and then it would go away for 2 days and come back after 3 days. And I didn't know what was going on. I thought, okay, well, I guess this is just what radiation and this chemo drug feel like. I guess this is just how it's going to be. And finally it got to the point I couldn't take it anymore. It took everything that I had to pack a bag and to go to a university emergency room. And when I got there, because of dysautonomia, I don't usually have fevers. So when I got there, I did have a fever. It was about 100, but I kept having rigors. I was shaking so bad. And you would think, because I had a port and it was accessed, like you would think that they would have put 2 and 2 together. They didn't. They tried to send me home, and I started bawling. Like I could not take another day of that. There was no way. And then they talked about sending in a social worker, and I'm like, oh brother, they think I'm crazy. But they didn't send in a social worker. They actually sent in another doctor who agreed to keep me for observation and additional tests. Within about 10 hours, they had cultures from my blood work showing that I was septic. And they never mentioned a social worker again after that. Jeez. You know, when somebody's got rigors, that should be like your first clue that they're probably septic, especially given my history. I don't understand. But anyway, I was admitted to the hospital. I was admitted to, first of all, the cancer floor, and then I went into DKA because of diabetes, and they sent me to intensive care for a few days. I got out of intensive care. They removed my port, and that port was on this side. They put in this port, which was extremely painful. So anyway, I recovered from the sepsis. I had a new port, and I stopped my radiation. I couldn't do it. I was so stinking weak from all of that. So anyway, I got better, and then in August of 2018, I kept having really low blood sugars, and I was really weak all the time. So my local oncologist thought that I should undergo an ACTH stem test to determine if I had adrenal insufficiency. And here's yet another mistake. After surgery to remove my adrenal gland, I should have been tested for adrenal insufficiency. And personally, I think that my good adrenal gland could not keep up with the stress of my physical condition, all the things that I was going through with radiation and the mitotane. I think that the adrenal insufficiency weakened my immune system enough to make me susceptible to getting sepsis. I've had a central line or a port for almost 5 years. I've had one or the other for going on 5 years and never ever had an issue. So I just think it was adrenal insufficiency. Anyway, September 2018, I had an ACTH stem test done that confirmed that I was adrenal insufficient, and I am on replacement steroids for the adrenal insufficiency. So 2018, 2019, I was diagnosed with Graves' disease. Graves' disease is a thyroid disorder. It makes you hyperthyroid. Within about 3 months, I had lost nearly 60 pounds. And I have blood work done every month, and I have had it done for years every month to check my thyroid levels. For about 3 or 4 months, no one told me that I was hyperthyroid. I don't think that they read your tests sometimes. Like, how do they miss all these things? I mean, it's been like one thing after another in the last 5 years. And I'm telling you, you have to stay on top of your own medical records. Anyway, so Graves' disease, and then I was diagnosed with a thymic mass. Your thymus is in your chest area, and there is like thymic hyperplasia there, and they don't know exactly what that's from. It could be from Graves' disease. It also could be from myasthenia gravis. So I don't know. We just continue to monitor that. So basically, I think that's about everything. I know it's a lot. It's a lot to take in. It was a lot to live through. So basically, when you see my vlogs, these are the things that I'm dealing with every day. It's a lot. It's overwhelming. It's hard. It's really hard to have that much going on. It's hard to explain to people. You know, they can't see inside of you what's going on. All they see is your outside, and oh, you look fine. You know, you have your hair. You're good, right? I don't know. It's just hard when you're living with so many invisible illnesses. And my motto has become to take the invisible and make it visible, because a lot of people are suffering and no one has any idea why. A lot of people pass judgment on people with invisible illnesses. It hasn't happened a lot to me personally, but I do know a lot of people that it has happened to. And it's so wrong. They have no idea the battles that many of us are facing. So anyway, if you'd like to support my channel, please don't forget to hit like and subscribe. I appreciate so much that you're here. If you have any questions, please just leave them in the comments and I'll get back to you. Thanks so much again, and I'll see you soon.